Hi, I'm Dr. Huseynova and I welcome you again on my channel, Dr. Tuti. Today my presentation is going to be about limited response of the cornea. Cornea, as most of the tissue, has a limited number of responses to a variety of diseases and insults. Here in this slide, you can see all the limited responses of the cornea, which are defects, fibrosis and vascularization, edema and cysts, inflammatory and immune responses, deposits, and proliferation. I will talk briefly about each limited response of the cornea with a few clinical pictures. Defects. Defects can be acute, recurrent, and chronic or persistent. At all corneal layers, this cement membrane has less tensile strength than full-thickness stroma. Therefore, conditions in which the cornea is stretched may produce breaks in this membrane. Stretching the cement membrane horizontally and creating vertical or oblique breaks, for example, elevated intraocular pressure in infantile glaucoma stretches the cornea and creates circular breaks in the cement membrane. The thin ectatic keratoconic cornea can stretch to produce a focal, spontaneous elliptical rupture in the endothelium and cement membrane, for example, in acute corneal hydrops. You can see it here in a latest stage of keratoconic patient. And this is an OCT image of corneal hydrops. Next response, fibrosis and vascularization. Fibrosis never occurs in the epithelium or endothelium. Fibrosis and vascularization are part of the normal repair process and do have a beneficial effect, for example, stabilizing the corneal surface. And the appearance of vessels in the cornea is a response to chronic inflammation. And of course, sometimes when the fibrosis and vascularization takes part in the center part of the cornea, it will definitely affect the vision. Edema and cysts. Epithelial edema associated with the high pressure in acute angle closure glaucoma. Bullous epithelial response caused by loss of endothelial barrier and pump function in pseudophakic eyes, for example. True cysts do not occur in other layers most of the time, and they occur only in epithelium. And cysts are focal collection of fluid. The next response is inflammation and immune responses. This type of response has additionally a few kind of reactions. For example, immunoglobulin E mediated atopic or anaphylactic reaction. For example, in case of vernal keratoconjunctivitis. Here you can see the picture of the typical conjunctival inflammation. The next is antibody-mediated cytotoxic reaction in case of Murren's ulcer. Immune complex reaction in case of herpes simplex stromal keratitis, and delayed cell-mediated response in case of corneal allograft rejection. Next, we continue with deposits. Deposits, they commonly caused by three factors: drugs. So there are some cases when there might be corneal changes based on some medications which patient is taking at that specific time. Drugs and metals deposit in the cement membrane, and melanin pigment selectively deposits in or on the endothelium. Ocular systemic diseases, for example, it might be also a reason of deposits in or on the surface of the endothelium. Endothelial cells, they phagocytose pigments in disorders such as pigment dispersion syndrome and Fuchs endothelial dystrophy, creating the clinical appearance of fine dusting of the posterior surface of the cornea, often in the form of a vertical central Krukenberg spindle. The vertical pattern of melanin's distribution comes as the result of aqueous humor rising posteriorly in proximity to the warm iris and falling anteriorly on contact with the cooler cornea. Here in this slide, you can see this vertical collection of melanin in the central part on the surface of the endothelium. It's shown with white arrow. And corneal dystrophy and degeneration might be also a reason of deposits in the cornea. Among corneal dystrophies, only macular dystrophy produces deposits in the endothelium and descemet membrane. And the most common material deposited in descemet membrane is lipid as part of a corneal arcus. And the last of limited responses of the cornea is proliferation. Proliferation occurs as a result of two phenomena: abnormalities of growth, which might be hypertrophy, hyperplasia, dysplasia, or neoplasia of the tissue, and ectopic migration of the cornea. In case of epithelial ingrowth after LASIK, a fibrous ingrowth of the stroma, and endothelial migration across the surface of the iris. This was the brief information about limited response of the cornea. Hope it was informative for you. If you have any questions or comments, please add under the video in the comment section. And if you're interested in future videos, upcoming projects which are coming soon, please subscribe to my channel. Thank you for watching this video. I'm wishing you a good day. Bye.